to talk about my beef with conventional testing for thyroid. Hi, I'm Dr. Stephanie Nichols. I'm a naturopathic doctor at Onyx Integrative. I have a beef with how thyroid is being tested for and treated, because the way conventional medicine tests for thyroid misses about half the population of people who have an abnormal thyroid. I don't know about you, but that seems like a lot of people. And let's dive into this a little deeper. So the way conventional medicine tests for thyroid is that they look at one, sometimes two markers. The first one being TSH, or thyroid stimulating hormone, and the second being T4, which is our inactive form of thyroid. And in terms of TSH, the higher the level is, the lower your thyroid is functioning. Right now, we have certain reference ranges, meaning if you fall into this category, you're considered normal, which is 0.4 to 4.5. It used to go a lot higher, but recently they've cut it back. However, this does not tell us the whole story, because first of all, it doesn't tell us how much thyroid hormone we actually have. So only if your TSH is considered out of range will your doctor ever look at your actual thyroid hormones. And when they do, it's usually that inactive T4. So I'm sure you're starting to see the problem already. There's a condition called euthyroid 6 syndrome, and that's when your TSH is in range, but your thyroid hormone levels are actually lower than optimal. So this would never be caught in conventional medical testing because they're just looking at the TSH. And let's get on to T4. So T4 is the first version of thyroid hormone that our thyroid makes. This is not the active form. It then has to be converted to T3. And this requires a lot of nutrient cofactors, meaning nutrients that help this process along. And those are selenium and zinc for the most part, as well as some other vitamins as well, but those are the two heavy hitters. So if somebody has a deficiency in either of these two minerals, they're not going to be converting T4 to T3 very well. So on their lab test, if T4 was normal, we really have no idea what T3 looks like. And that to me is a huge miss. And that's part of my beef with how thyroid is being tested for. So let's talk about what hypothyroidism looks like and feels like. The main symptoms are feeling tired and having a decrease in appetite with a difficulty losing weight, which is extremely frustrating because people want to eat less, they're not losing weight, and it's a whole vicious cycle. Also, problems with constipation because things aren't moving as quickly in the body, reproductive issues like heavy periods, as well as issues with dry hair, skin, and nails, and feeling puffy and like you're retaining water. Those are some of the more classic thyroid symptoms. And the thing about them is they look like a lot of other symptoms of other conditions. So it's easy for a doctor to think that these symptoms are caused by something else, when in fact it is your thyroid. So I'm sure you've been in this scenario before, or you've had a friend or family member who's experiencing some or all of those symptoms, and they go to the doctor, and the doctor says, let's run some tests. And they do. And when you come back, the tests say, everything's normal. Your doctor says things look great, you're good to go. And on the inside, you're fuming because you know everything's not good to go. You feel like crap. But in their eyes, it's not thyroid. Well, in actuality, it totally could be your thyroid, and they're just missing it. That's where more comprehensive testing comes in. And naturopathic doctors like myself specialize in this kind of testing. When seeing a naturopathic doctor, they're going to look at not just your TSH and T4, but they're going to look at your T3 as well as reverse T3, which we'll get to in a minute, and your thyroid antibodies. So the total amount amount and free amount of T3, which is the active thyroid hormone in your body, is important to look at. Because as we were talking about before, if your body's not converting properly, that level's going to be low and missed. So we really want to know how much of that active thyroid hormone is floating around, because that's what we care about. The second one that I mentioned is reverse T3. So this is one that I rarely see conventional medical doctors test, and one I almost always test for. And the reason for this is it shows some interplay between your level of stress, what your adrenal glands are doing, and your thyroid function. A reverse T3 is a form of T3 that's kind of been mutilated, so it's not functional. And there's a reason why our body does this. If you're under a lot of stress or you're really depleted, your adrenal glands start to produce a lot of cortisol under times of stress. And that's signaling to your thyroid that you're depleted, you're under a lot of stress, your body can't handle it. It's its way of telling your thyroid you need to slow down, body. It causes this conversion from your active T3 to this inactive T3. And that's called reverse T3. When these levels are high, it can give us a great picture into what the underlying cause of your thyroid condition is. And it could be rooted in something other than the thyroid, like your adrenal function or your mental emotional state, like stress and anxiety. The other thing that's important to test for is antibodies. Most common cause of hypothyroidism is Hashimoto's thyroiditis. And this is an autoimmune condition, meaning your body is essentially attacking itself. This is also very rare for conventional doctors to test for. They do it sometimes, but the reason that they don't is because for them, treatment doesn't change. Whether you have Hashimoto's or you don't have Hashimoto's, they still treat you with a thyroid replacement, which is essentially T4. And the reason why thyroid antibodies are important is because if you do have Hashimoto's, which is the most common cause of hypothyroidism, there are specific changes to your diet, to your supplement regime, and your lifestyle that are important for you. Some of those things include a gluten-free diet, because gluten looks very similar to our thyroid hormone in terms of what the body sees and what the immune system sees. Oftentimes, people are reactive to gluten, and those same immune cells that are acting upon gluten also damage the thyroid. To get that autoimmune process down, it's important to cut gluten out of the diet entirely. Other things that are important in bringing those antibodies down are those same cofactors, selenium and zinc. There's a specific strategy for Hashimoto's that might be a little different than other causes of hypothyroidism, which there's many. Some of those conditions that can lead to hypothyroidism are Hashimoto's, being exposed to things like pesticides, heavy metals, fluoride is a big one. Those are all very toxic to all of our cells, but our thyroid seems to be the most vulnerable to some of them. Fluoride actually replaces iodine in the thyroid, which is one of the most important trace minerals for your thyroid's optimal function. If you've been exposed to large levels of fluoride, there's some steps you need to take in order to get your body rid of the fluoride and get your levels of iodine up. Also, heavy metals, like I mentioned, tend to interfere with thyroid function. Testing for these and knowing if your body has a high burden of them is an important step. Medications are also a cause of hypothyroidism, and psychiatric drugs like lithium are one of the most notorious drugs for causing hypothyroidism. There's a long list of other things that can interfere with your thyroid. And truly, our body is a puzzle, and all the puzzle pieces fit together, and it's really different for everybody. Working with somebody that takes that approach to not just treating the thyroid with a medication, but looking at the reasons why your thyroid might not be functioning well, And having specific recommendations to get your thyroid and the rest of your body back into balance is key. If you'd like to have your thyroid tested, you can click the link below or visit our website, and we can get you set up with some really advanced testing and an awesome doctor like myself who can help you take steps forward to regulate your thyroid and feel better. Thanks for listening to my beef. I have more beefs to come, so stay tuned.